So Halloween's coming up this Saturday. Are we going to get that? Can we trick or treat?
I think if people choose to trick-or-treat, the CDC has said trick-or-treat does carry some significant risk. I think what we're saying is if you're going to choose to trick-or-treat, there's some things that you can do to reduce your risk. And we can get to that in a minute. What I'm really worried about with Halloween more than the trick-or-treating is the parties, especially amongst younger people. When I say younger people, I mean people in their late teens and 20s and 30s. That's where we really are seeing significant risk and a significant number of people coming down with the disease. So we're really asking people, first and foremost, to stay away from parties and large gatherings. This is probably the year to find the scary movie and make a bowl of popcorn and find ways to have fun where you're not in indoor crowded settings. That's really kind of like throwing gasoline on a fire. Now, for trick or treat, what I'm saying is, we're saying is there is some risk involved in that. I think there are some things that people can do. I'm going to let, my kids do some limited trick or treating. If they're sick or they've been exposed to someone who's sick, stay home. Don't hand out candy. Number one, go in smaller groups and respect that social distancing. Don't have big groups of kids. And then if people can find ways to distribute candy that avoids that face-to-face contact and doesn't force kids to dip their hands into that communal bowl to fish out the candy. And then the other thing that I think is an interesting idea is have a stash of candy that the kids can have the night of trick or treat, but take the candy that they've gathered and let it sit for 2 or 3 days. The virus doesn't live well outside the body, so maybe have that stash that kids can share, and then let the candy that they're gathering sit. I think there's ways that you can do it, and I think there's ways you can reduce the risk. But I think people should really be cognizant of the fact that there are risks involved in it, and certainly if you're sick, we ask you not to go out, and we ask you just to put a sign at the door and just say, I'm not feeling well. We're not going to be giving out candy this year.
And that's one thing that we've kind of been chatting about is letting the candy sit for, 72 hours is way easier than wiping down every single piece of candy.
Absolutely. That's absolutely.
So are you more worried about the parties because it's on a Saturday night, or just because we're in the pandemic and people party at Halloween? Yeah,
right. It's both of those things. It's a Saturday night, so I think it's a full moon. It's a all kind of blue moon. I'm hearing. I think it's an unfortunate coincidence we're having Halloween on a Saturday during a pandemic, and we see that you often tend to get alcohol mixed in there. People's sort of social inhibitions come down, and we're really seeing a significant number of cases associated with those social settings.
Along with those social settings, are there any restrictions that are going to be placed on bars or places downtown to kind of reduce that?
We're really working hard with the bars to make sure that everything that, not just downtown, but throughout the county, to engage them and to try to get them to continue to follow the rules. I have personally been downtown, walked Main Street an hour or two before bar time just to see how things are going. And generally, I'm seeing most bars, not all, but most bars really working hard to follow the rules. The ones that are not, we're reaching out to have conversations. Sometimes that results in a more formal action. But what I'm seeing from the bars is they're really trying. I don't foresee any formal action to restrict what's going on at the bars, but we really need to continue to see people. And I would recommend people, especially people who have underlying health conditions or are older, to stay away from those areas, especially later at night.
Talking with Matt Kelley, health officer for the Gallatin County Health Department. Since we have you here this morning, can we ask you, Missoula just put in some pretty strict restrictions. Any chance that's going to be coming our way in the future?
We're looking at everything right now. I don't have anything immediately planned, and the board isn't meeting this week or next week. So no, not in the immediate future. But we're looking at what other communities are doing, and we're going to try and strike a balance between things that are effective while keeping businesses healthy and keeping our populace healthy.
And I guess that's the same looking at a little further to Thanksgiving and Christmas.
Yeah, I mean, Thanksgiving and Christmas are worrisome in different ways. We tend to bring people together different generations come together. We're in for sustained contact in indoor settings. That's also a recipe for disease transmission in a different way. And so, we really want people to think about and really think carefully about bringing those folks together. The last thing you want is to have one of those joyous holiday events associated with illness or tragedy for the rest of your life. And so this may be the year to keep the group smaller. We know people are going to get together, but I think those really large settings, and then really thinking about people who are older and people who have those health conditions that could put them at greater risk. Because when you're bringing young people who are really driving the pandemic right now together with older generations, that's pretty worrisome.
So are we in flu season yet, or when's flu season really hit?
It really varies by the year. Our surveillance is saying we're not yet into flu season. We're not seeing a significant number of flu cases yet.
Because some people were trying to make a correlation between flu and COVID with not very many flu cases, and I didn't understand what that was.
Well, I think what we're trying to do is get people vaccinated against the flu, because if the smaller the number of flu cases we have, the less burden that's going to place on our healthcare system, and the less uncertainty people are going to face, when they get sick. If you get your flu shot and you can avoid getting the flu, that may save you the experience of wondering for a few days whether or not you have COVID.
And one, if you get one or the other, it doesn't keep you from getting the other, right?
No.
If you get COVID, you could still get the flu, right?
Absolutely.
So there's no immunity from that there. All right. Is there anything you want to add, Matt, while we got you?
Yeah, I mean, I think it's important that everyone understands we're going into a period of time. We've got a long winter ahead of us. If you look around the country, if you look at the Dakotas, Montana is currently number 4 in the nation of COVID-19 cases per capita. North Dakota is number 1. South Dakota is number 2. Idaho, Utah, and Wyoming are all seeing a pretty rapid increase in cases. Last week, we had just under 600 cases reported in Gallatin County. And prior to that, we had barely cracked 300 cases in a week. And so that level of disease is very, very worrisome for us, especially with the long winter ahead. And we know the pattern. The case numbers spike. Within a few weeks, hospitalizations rise and then deaths follow. And my worry is that we could be seeing the future by looking at what's happening in Yellowstone County or the Dakotas, where we're seeing hospitals start to fill up, and we're seeing more deaths. And so we're really encouraging people and trying to do what we can. At the Board of Health meeting last week, I heard a lot of people say, we want recommendations. We really think recommendations are the way to go. Well, here's your recommendation. Stay out of crowds. Stay away from large group settings. Let's see if we can make this work, because in some of these places in North Dakota and Idaho, the governors are starting to put in place, and some of the local leaders are starting to put in place rules because they're being forced to, because the hospitals are filling up. And we're really trying to avoid that here, but it's concerning the number of cases we have and what we've seen happening around us.
Just so we're clear, here locally at Bozeman Deaconess, we're still doing pretty good, right, as far as space goes?
Yeah, it really fluctuates. I just had earlier this week, I had a conversation one morning, yesterday morning, in fact, I had a conversation with Bozeman Health, and their critical care beds were at 90%. Their respiratory care was at 92%, and the rest of the hospital was over 90%. That was happening on Wednesday. So it's really concerning. Now that will fluctuate pretty wildly. They also were expecting some people to leave the hospital that day, but it can go up and down pretty quickly. And what we're seeing in Billings, what we're seeing in Great Falls, what we're seeing now in Helena, apparently, is concerning.
All right. It's Matt Kelley, Health Officer, Gallatin County Health Department. Thanks for coming on today. We appreciate the update. And again, if people are out this Halloween, just try to keep it to a minimum, right?
Yep. Thanks, Dave.
All right, Matt. We'll talk to you soon.